We all have mental health. It is just as important as physical health. It is not only about mental illness or mental disorders. This is just one part of a bigger picture. It's best to think about mental health as being on a continuum, rather than people being either mentally ill or mentally well. We are all on the continuum, and we move up and down according to factors such as our genetic makeup and upbringing, our life circumstances, and the stresses we are under. At one end of the continuum, we have mental disorders, like depression or anxiety. And at the other end, we have states of positive mental health, when we're thriving, content, and fulfilled. The aim of mental health interventions is to move people up the continuum so that they're able to reach their full potential and live satisfying lives. The World Health Organization describes mental health as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Being mentally healthy means being resilient and able to cope with difficult times, feeling in control, being confident, feeling good about yourself, managing and expressing your emotions, building and maintaining good relationships. We all experience periods when we feel stressed, worried, anxious, sad, afraid, or angry. These are all normal emotions. However, when these emotions become severe enough that it interferes with a person's ability to function daily, and these feelings become persistent over time, then it can develop into a mental health problem. There are many different types of mental disorders. When left untreated, mental disorders can be chronic and long-lasting, and are associated with increased disability. They significantly have an impact on daily functioning and frequently interfere with family, social, and work responsibilities. Fortunately, there are effective treatments and evidence-based interventions available that aim to help individuals understand and cope with symptoms of mental illness. However, very few people with mental disorders access existing treatment services. This may be due to barriers such as the stigma attached to seeking help, the lack of understanding of mental health problems, uncertainty of how to get help, or the fear of disclosing mental health problems. Research shows that stigma remains one of the biggest factors preventing people from seeking help early for their mental health problems and getting the appropriate support they need. It is important to acknowledge that we all have mental health and have a personal responsibility to learn how we can improve and maintain our well-being in order to lead meaningful and satisfying lives.
In this video, I'll answer the question, are mental health and emotional health the same? Let's get started. When we strive to live a healthy life, we think mostly of losing weight, being more active, and eating healthy. While these things will contribute to our overall well-being, they might not deal with some of the issues we prefer to neglect, emotional and mental health. You might find yourself wondering why these two aspects of being human are so important if no one can really see them. But that's exactly the point. Because we keep our feelings and emotions hidden from other people, they can become toxic over time, eventually leading to mental health issues like depression, anxiety, or panic attacks. Looking after our well-being and trying to live healthier is not just about the physical. So what's the difference between mental and emotional health? Mental health is described as behaviors and functions dealing with the mind and brain. It's how we process and store information, our cognitive thinking patterns, and paying attention. These processes are fueled by various hormones and neurotransmitters and can sometimes go awry. This usually happens when there is an imbalance in these chemicals, either because of genetics and family history or because of the misuse of mind-altering substances like drugs. It's estimated that at least 1 in 5 people in the United States suffers from some kind of mental illness. This includes conditions like depression, bipolar disorder, anxiety, schizophrenia, eating disorders, post-traumatic stress disorder, and attention deficit hyperactivity disorder, or ADHD. Mental health conditions can also be triggered and worsened by chronic stress, which can have an impact on other health conditions like high blood pressure, irritable bowel syndrome, and chronic inflammatory conditions. When we don't learn how to deal with stress appropriately, we can become trapped in a never-ending loop of physical and mental health issues. Emotional health is the lesser discussed third aspect to our overall well-being, but actually plays a more significant role in our health than we think. Our emotional health is intertwined with our mental health and our ability to handle stress. If mental health is how our brains think and function, emotional health is how we express these feelings and emotions. People who are in a healthy emotional state know how to appropriately express their thoughts and feelings in certain situations and can deal better with the positive and negative emotions that they experience. Being emotionally well doesn't necessarily mean you're always happy. It just means that you can cope better with the challenges life throws at you, and most importantly, how well you're conditioned to handle stress. Mental and emotional health both need to be managed so that synergistically they can work together to help us relieve feelings of depression, anxiety, stress, anger, disappointment, and more. Think of it like the one feeding the other, and the stronger the one is, the better the other, and vice versa. If you feel that you may be suffering from a mental illness, it's best to see your healthcare provider for advice and possible treatment. You can also work on improving your emotional health by trying some of the following tips. Daily meditations and mindfulness practice. Practice positive thinking and positive affirmation. Think before you act. Look after your physical health by exercising and sleeping enough, as it can help to reduce stress. Create a balance between work and leisure activities. Connect with others. Try talking about how you feel and your daily struggles. Be aware of your emotions and feelings, what triggers them, and if they are exaggerated. Mental and emotional health are not the same thing, but they do work together and keep you balanced, happy, and stress-free. Next time you hit the gym to improve your physical health, remember that these two important aspects of your well-being should not be neglected.
Hey everyone, this month's topic is social wellness. And nope, not talking about the number of followers that you have on Instagram. Well, we hear a lot about physical, emotional, and even mental well-being. But have you ever thought about your social well-being? Social wellness is a measure of how we interact with others and create meaningful relationships. As humans, we have this basic need to belong and to connect. But over the years, as our society has changed, our social interactions have diminished. When we have meaningful connections, we tend to eat healthier, exercise more, and are less likely to smoke. Having others to rely on our support helps us better manage our stress. And did you know that people with strong social networks have a lower risk of cardiovascular disease, diabetes, and arthritis, and are more equipped to fight off infections? You can probably guess that social wellness plays a big role in mental health. People who have meaningful relationships experience greater happiness, whereas those who are more isolated have an increased risk for depression, anxiety, and even suicide. And let's not forget about brain health. Social engagement keeps our brains healthy as we age, reducing the risk of developing dementia or Alzheimer's disease. Not only does having a healthy social network help us in small ways like fighting off the common cold, but it also helps us in big ways like living longer and living happier.